And I'm just going to make a brief introduction here. So today it'll be about 30 to 45 minutes, depending on how much thoughts, how many ideas you guys have. So I'd love to get your feedback. I first want to introduce Mary Hudson McKinney. So actually, let me click on this. So Mary and I have worked together for a few years, and she is an amazing professor. You can see that she has spent the bulk of her years teaching in neuro, certified in neuro, teaching in entry-level DPT programs. And so when we thought about, hey, Mary, what are we going to do about all these patients we used to bring in that we can't bring in right now? How are we going to bring the learning to the students? We spent all of last year visiting homes of patients and trying to capture the things that they do in their daily life. So here are a couple of questions that we were asking as we're thinking about task analysis and movement analysis. So how do I bring the patients and their movements and tasks of daily life into the classroom? Because I remember, Mary, we used to do that every year. John would come, a number of the different patients would come, and the students would actually have little groups. Is that right, Mary?
Yeah, so they would be broken up into usually about a 1 to 6 to 8 ratio. So one patient for every 6 to 8 students, and then we had a person then overseeing maybe one to 3 groups, faculty person overseeing 1 to 3 groups, depending upon the complexity of the patient. And it was just a wonderful experience. And the students got a chance to do it repetitively. So about 8 different sessions. And so they got a chance to really develop and look at patients from a variety of different neurologic diagnoses, from MS to spinal cord injury to traumatic brain injury, stroke, etc. Parkinson's. So it was just a great experience.
Yeah. And the other thing we were thinking about too is, how do we create a stable and available resource for the students and the faculty to be able to pull up videos easily anytime you need, so that the students can begin to develop their task analysis and movement analysis skills. And so actually fairly early in the development of the app, Mary and I and Jordan, we're talking a lot about what direction is the profession going? What are the frameworks that we should be looking at? And how can we facilitate those in the classroom? So what I'm going to do here is just go over to, let me go over to my, go over to the app here. And for those of you, who are first timers to some of the PhysioU apps, PhysioU is a collection of PT focused apps. And so we have carefully begun to build apps in every content area that we think apps and videos and clinical reasoning, all of those pieces we are trying to bring into one place to make it easy for faculty to teach and better for the students for learning. So what you see is I've just logged in at PhysioU.health. I did the sign in, and you can see the list of apps continue to grow. So if I search here for all the neuro rehab apps, you'll see that there is neuro exam that covers all the examination procedures that you're going to ever have to teach for neuro, from stroke, Fuglemeyer, stream, Asia, vestibular, balance testing, tone and spasticity. Everything is here. Neuromuscular rehab, which covers the bulk of the interventions, P&F, which we worked with Kaiser Vallejo and one of their faculty. So this is essentially their lab manual for their course. So all the P&F techniques. And then here leads us to the task analysis app. So let me go there for a second. So Mary, do you want to speak briefly about how we developed well, actually, let me just say, we developed the idea of learning, which is, I think, an entryway for faculty and students to help develop the concept of movement analysis from a couple of different perspectives. And so, Mary, do you want to just mention kind of our conversation or our thoughts behind why we put both Sheetz and Hedman in there?
So we have Hedman is more of the classic motor or movement analysis paradigm where the individual is looking at any number of tasks such as sit to stand and looking at different periods of time within that movement sequence and analyzing the individual, the patient from the perspective of their alignment, their base support, how the movement then sequences, so the execution of the movement and then the termination phase. And so it basically looks at the classic, if you look at the original Hedman article that was published, it looks at those different snapshots: initial condition, preparation, initiation, execution, termination. And so what we did with this is we looked at several different tasks using this model. And then in the learning phase, it's a guided process for the student to go through. So they can watch, and we're basically providing the input. And then we provide a SOAP note or a documentation example. And then, it gets into a couple different movement sequences, but this is just one example of a person transitioning from standing to sitting on a commode chair.
And to piggyback on that, so what we've done is you have the whole task. So the students and you, or these, my vision for this, and I'll be curious of your thoughts of how you would use it in your classroom, is that the learning phases are things you could assign to the students after you've given them the basics in what you've taught. So the reason why learning's cool is not only is there the whole task, but there's all these little different phases broken up. So we asked the videographer to break up the video into small segments. And with each phase, Mary has done a short write-up to help the students begin to visualize and see what a clinician is looking at and what they're looking for. At the very end of, let's say, termination, you can see that there is a documentation that Mary's done, a SOAP note. So my thought was that these could be assigned as an assignment for students to do before they look at the documentation, before they look at all of these notes. We can give them a worksheet to now look at a few of these select different tasks. So if we look at sit to stand here, we can look at the side view. And in some cases, we've set it up where you can watch them together. Mary has gone through and nicely put down little notes here. Now, one of the questions I would have for you is, should we hide these answers under a dropdown so that if they're doing this as an assignment, the answers aren't open available for them to look at? They would have to click on the down arrow for the answers to become apparent. So if we created a worksheet, they could fill the worksheet out. And I believe we do have a worksheet that they can use. They could fill the worksheet out, and then they could look at the answers that Mary has written, as well as we can ask them to do a SOAP note. Well, it'll be difficult to do a SOAP note because they don't have the history, but at least Mary took the time to put all of this together so the students could now have something to model after. Let me just stop for a moment and get your thoughts about the learning phase of the Hedman component. Any comments from anybody? Please feel free to just unmute yourself. It's a small group and love to hear your thoughts.
A couple comments in the chat, Mike, that are real quick.
Okay, so again, yeah, Michelle, the drop-down menu. Yeah, Julie also. Okay, great. So we'll go back in and convert those to drop-down menus so that when you actually watch some of these tasks, And we also tried to make sure we had a lot of different ethnicities, a lot of different gender, and as well as different conditions. Other thoughts or comments? Any ideas about how you would use this in the classroom that are kind of floating up in your mind? Got it, Jana, thank you. Any thoughts?
So this is Lori. I was just thinking, I do a movement analysis and we do it with the students and analyzing a task or a movement activity, and we collectively start to break it down. But this would be a good adjunct sort of to have so that we could show it in video over and over again, which makes it easier, because when I feel when someone does it as the person who's demonstrating, you're gonna adjust your movements over and over again. And based on the feedback you might even hear, but here they could just see it and over again be able to use it. So I love this. I would use these videos in teaching movement analysis. And then before I would scroll down or click on the other information, we would have a discussion about it, and then we would go to see what was actually listed in, and if the students missed anything.
Yeah.
Mike, there's a question in the chat that I'm not sure, Andrew, you wrote in there about integrating this with a polling site. I'm not familiar with that.
Andrew,
What
if
is
you
that?
don't mind unmuting yourself and sharing the idea with the group, I'm intrigued.
Well, in the class I'm teaching now, and it's something we're integrating more, where you have the ability for students to like a polling site. It's like, okay, what do you think is the salient thing here? So you can see in real time what their thoughts are, either in person or online.
That's a great idea.
Exploring the answers.
So like the students, like a third of the students said yes, third said no, a third said I don't know.
Yeah, and then exactly. And then you say, okay, well, it's going to go through this, and then you can show the quote answer.
Yeah, absolutely. That's not a bad idea. I mean, when you look at the whole task, you'll see that all of the different phases are all here. And any one of those polling, I think the challenge with the polling is being able to have enough screen space to show the video, and also to have the polling going on, maybe on a split screen somehow. And then taking a little bit of time. Now, remember, the value of this is this video will not go away. You will have this video. You don't have to hope that it'll be there next year on YouTube. That means that you can actually build your polling around a particular learning experience and then run it simultaneously. Currently, we don't have the ability to do the live polling, but certainly you could use Poll Anywhere or any number of those, and really have the students like really pique their interest. What are they seeing at initial condition or at preparation or at initiation, you know?
I like the polling idea too, but I don't think it necessarily needs to be up, or students need to be able to see who polled what. It just gives them a chance, the students that are take a little more time to process and answer a little bit more slowly, to be able to think that through in their head and put the answer in, because some of the students answer so quickly, the other ones don't have time to process.
Yeah.
So I like polling for that, even if nobody ever sees it, they just have to stop and think.
And most of the time it's anonymous, so nobody knows who voted what, or more importantly, be open-ended questions, so you get the whole thought process.
Is there value that the video can be replayed over and over? I mean, you can have an actual patient in class and they move one way, then the second time to do it, they didn't do it the identical way, and now there could be a slightly different answer with this. And like Dr. Wong mentioned, you don't have to go to YouTube, it's there every time. And so even before class, you can have your questions for your students prepared in advance, knowing the video is going to demonstrate these things. So you have a little more kind of permanence or structure to what you're going to be covering.
Yeah.
And then this could be also given as a homework assignment. So if, our time in class is really precious, and figuring out what elements, that we want to go ahead and focus in on during the class time, and what elements do we want the students to spend a little bit more time pondering on their own, then that, you could kind of use these different movement sequences to allow you to have both an in-class experience and a homework experience.
Yeah. The other thing too, I think that might be kind of interesting to think about. So actually, I'm going to make myself a Google Doc here. If you go back to, so imagine this is your, you know, your PowerPoint. So it could be your lecture. It could be your lab handout. You can go here, open the sidebar. Faculty have the option. This is an educator resource, so the students don't have this option, that for you to copy the page title with link, bring it to your lecture, drop that into your lecture. And you can also use this copy thumbnail image, drop it into your PowerPoint. And now you have a hyperlinked option to easily augment your lectures and labs. It brings you to this page. Now, it doesn't mean you can embed the video, but it's very easy. It just opens the video. Since you will all have faculty access, or you all already have faculty access, now you can actually augment your class, your activities. I mean, you could literally, for our ortho class, you'll see that we have links. Every single technique that I teach in lab, they have links to these videos. So that goes, of course, applies to all of your PNF and your neuro exam. You could add all of those to your lab handouts, and now you have videos and pictures for all of them. Let me move on to Sheetz. So Mary, do you want to mention a little bit about Sheetz?
We're in the process of building this one. So the Sheetz movement systems diagnoses basically is where this comes from. And so if you look at Sheetz work, she has basically looked at several of the things that Hedman is interested in looking at. So initiation is there, execution, termination, and then documentation. And so, but Sheetz has very specific movements, very specific static and dynamic movements that she's interested in having the students or the PT look at to render that diagnosis. And so, what she is looking at is tasks in a seated position, tasks in a standing position, and then also tasks that include altered sensory status. So in the eyes closed condition, for example. So the couple that we have currently built out is quiet sitting, and then there's going to be another one. So here's quiet sitting.
Yeah. So I think what we've done here is we've created samples that have the write-up from Mary, as well as the documentation again, so that students can now be exposed to the two kind of most common concepts or frameworks. So that's the idea behind Learn. Now, beyond learning, so this is, Learn phase has lots of feedback. It's almost immediate feedback because all of this can be hidden. It can be drop-down menus. The students can actually read what a clinical specialist would have written about this particular task. And then when you go into practice, we've broken up practice. Here you have this client, and we filmed all these key components. So here's front. We ask the students now in practice to complete the analysis below. Here are the key prompts. And
here's the worksheet too.
And then here's the worksheet. So let me see if I can make that a little bit bigger here. So students can you can download this and host it in your LMS. The students can download this and fill this out and turn it in. That's what practice was for. And so you have all of these different tasks or we go back to Sheetz, we can look at standing feet together.
All right, so now you've got your feet together. You're gonna stand up straight and tall, head up, shoulders over the hips, okay? And you're gonna hold that for 15 seconds. Ready, go. Now, let's try eyes closed, and I'll be right here, okay?
Ready?
Uh-huh.
Ready.
Excellent. Oh, eyes open.
So again, all of these in practice are now videos that are available for you to utilize in class to make your classroom interactive, or these can be homework for students to turn in. Mary, did you want me to show anything else from this, or did you have anything to mention, or should we open it up to the group for some thoughts?
Yeah, let's open it up. I'd love to get their feedback.
Any comments from the group? And please feel free to just unmute yourself. We'd love to hear your thoughts. Any things you would like to see? Any ideas of how you would use this?
For all the different tasks, we don't currently have an answer key for each of the different movement sequence in the
Practice.
in the practice phase yet.
Yeah.
So that's what I meant by we're building it out. So.
And when we get to Hedman, you'll see that there are so many different movements. I mean, we literally spent a day in the homes of each of these clients and filmed almost everything that they do in life. So it's a very unique opportunity to get a glimpse of these functional tasks and functional movements. I'm not sure if we will be giving a key for all of these, but that is exactly why we built the Learn section, was so that there would be enough answers to get the student to be able to model and to understand what was going on and what the clinician was looking at. And from practice onwards, it would be free for faculty to use what you thought was best for your class. So we'll just take a quick look at this.
What you're going to do is you're going to step up and touch the top of the steps. You don't have to step onto it. Just touch the top with the right foot, then your left foot, right foot, and then your left foot, or left, right, left, right.
Okay.
Okay. Ready, set, and begin when you're ready.
Okay.
So this is a real patient with challenges with this task. Right. Good. Excellent. Okay, very good. Very nice.
So again, all of these are now available for you to utilize however you feel like it fits in your classroom. That's Sheetz. Any comments before I move on?
Yeah, I have a comment. It looks great. I'm excited to get into it. You mentioned going to their homes, and can you show a video or how you actually, or I see the videos here in kind of the simulated environment, but I'd love to see it in the actual environment. Yeah.
So
okay.
If you think about the Hedman component, so for Sheetz, we actually brought John in and we did all of it in a very clean environment. But what you'll see here, for example, with Charmaine, CVA right-sided hemiparesis, a 62-year-old female, we filmed everything from, for example, we could look at dressing. I think actually maybe a better example is, I'm going to go to John and go back to John here. We can look at dressing, for example. So this, we always allow, so this is John dressing. So this is a 6-minute video. You will see, let's take little glimpses throughout.
Yeah, I think when you film it in the environment, you get such a much more realistic application. I think
Yeah,
that's great.
absolutely, absolutely. And, you know, and also we put compared to typical, because then you could very quickly have conversations. I mean, it brings out some of this, in some cases, some of the subtle differences and some of the very, very clear differences. So you have close view, wide view. So let's go.
Take a look at some of the other tasks too, because it's pretty amazing, everything that's been captured.
Like what, Mary? What would you like to show?
Well, the financial management, the grooming, the toileting, getting out of bed, you know, lots of different things. So you can see manipulation issues here.
Can I look at that worksheet again? How you guys, because I do a similar worksheet, but I kind of add a little bit more on mine.
Yeah, I can bring that up right here. Let's see, where is that? It's
Gary,
right.
Gary, I like your point that, you know, the real world is like, yeah, the artificial thing, we try to replicate it in the clinic, you know, for practice. But if, you know, you see where he had to pause clothes in his sink. Well, in the rehab center, you might have like a little rolling table you put next to it, so it's convenient. But hey, that's not how it works at home, folks. It works very differently. Yeah, so it's a good call, Gary.
Yeah. So I put the link to the worksheet in the chat. So again, you can see things like this. You can see the front view of that. So we usually had 2 cameras going.
One thing I like about some of these tasks is if a lot of the programs are now looking at doing some consideration of interprofessional practice. And so this type of a situation lends itself quite nicely to, you know, occupational therapy students and physical therapy students working in concert with one another in terms of, you know, what are we seeing in terms of essential skills this individual needs to be able to do, and how can we work as a team to move that patient forward? So it better prepares them for interprofessional practice out in the clinics.
So again, you can see we put compared to typical. We can take a look at eating. Again, this is John.
He's a huge Dodger fan, so that was quite apropos with his t-shirt.
Side view of that.
How much information do you have, like in a patient summary, or like, for example, was he right-hand dominant before his CBA? Is there any information like that?
That is perfect timing for case studies. So here is practice. Practice essentially, if you look at Hedman's practice, we have made a, sorry, let me get rid of that. We have basically, I wonder why, oh, there we go. We basically tried to create a relatively large library for you to pick and choose from. Different patients, different types of conditions, and then typical female, typical male. So there's, we're all wearing skin colored tights, but we're getting undressed, we're getting into the shower, we're donning and doffing underwear, we're getting on and off the toilet and wiping. All of that is here.
Getting in and out of cars.
Getting in and out of, that's right.
John is even mowing his lawn, doing some barbecuing, so it's basically trying to capture a lot of different tasks and skills that patients need to be able to do to be able to function well at home.
Yep. So there's a number of these different types of tasks. We have so many videos. We purposely went through and just pick and chose what we thought was most useful for you in the classroom, because having a million videos meant you'd have to search through a million videos. So again, you can see that all of these different views, I think, allow you to actually really give the students a good chance to analyze the task and to have great conversations, I think. If you move into case studies, so let me move into case studies here. Give it a second, there we go. So you can see with Charmaine or with John, there is getting in and out of the car, there's him mowing the lawn, they're sweeping the garage, and here is that history that you were asking about. So it tells a little bit about his story. And from there, here are the key tasks. So again, we went through and tried to analyze, or tried to basically capture video of him doing a number of tasks that we thought gives the faculty a nice spread of different types of function. Any thoughts or comments as we're watching John getting in and out of the vehicle?
Quick question. So do you guys, when you present the cases, do you have them put it in the ICF form so that way they can kind of identify all those areas that we need to? It's just a thought, because that's what I have them do is they got to fill it out, and one exercise is find the codes, and then then the other exercise is coming up with other ideas that potentially could affect them, the clients, I should say.
Yeah.
Right. So we haven't quite done that. We haven't gone to that step as yet, but that's an interesting thought.
So Kat, when you say, so you basically have them watching this video and then filling it out, a worksheet related to ICF?
Yes. Yes.
Got it.
And the other addition that I have for the Sheetz worksheet that you guys have, I love it. If you don't mind, I'm going to use some of that stuff too. But I also kind of put like little keywords for the whole, for those 3 areas: initiation, execution, termination. I added, okay, so initial patterns, what are you going to look at? Speed of movement, timing of movement. Is it atypical synergies? Those kind of things to cue the students. So they are, maybe I should look at that. Eccentric, concentric control, that type of thing.
Got it. Yeah.
And then on the other side, I have, the whole Sheetz thing, right?
Yeah.
I have the fatigue worsens, no change, not consistent, and improves as on the other side of the form.
Oh, over here.
Yeah. Or you can even do it on the second page. I really like this page. If you don't mind, I'm going to use it.
No, I mean, that's why we put it there, is for faculty to be able to use it. And then those ideas are great. Mary, you and I can talk about that, and we can always reach out to Kat as well to chat about that.
Yeah, absolutely.
Yeah. Other things that you guys would like to see? Any thoughts so far?
And this was on a windy day, by the way.
Yeah.
Extra balance challenge.
Yeah. So one of the things I've been thinking about, these prompts here, they're quite brief. Another thing we could do, Kat, you kind of just reminded me that perhaps each of these initial condition preparation, maybe we could add some prompts here. It could be a some drop down text as well. In the future, what I'd like to do is to be able to make this into a worksheet so that students could be watching and filling this out. I'm just not sure. I haven't quite figured out exactly how we'll do that yet. What we did here initially was just to put the prompts so that you and the students could be talking in class about initial condition, about preparation and what they're seeing, and just having a lively discussion without having to do any more work than logging in. There's just no prep that needs to be done on the faculty member's part. You can just go, you could go live and you can just talk about what you see and what you as a clinical specialist is observing. So that's why we built case studies this way. Of course, case studies comes with a little bit of that history, the write-up, and then basically us creating we basically did a selection. Mary and Jordan spent some time saying, for this patient, it would be great to show this. We don't need all 100 of her different functional tasks. Let's just put a nice selection that we think faculty would find useful. So it's from our perspective at PhysioU, it's always like we have more content than a faculty member would ever have time to use or even wants to bother digging through. In many perspectives, it's almost like if Mary, myself, and this small group of colleagues here on this call are like, hey, that grouping of different things are more than enough for the time I have available for me to teach with. That's the kind of goal that we were trying to achieve. Any things that you guys would like to see related to this app? That covers learning, practice, and case studies. Thoughts or comments? How do you think you might use this?
I like that this could actually work in that flipped idea. And that when they come in, I'm not wasting time doing the basic stuff. I could go right into this.
Yes.
That's what I'm excited about.
Yes,
Yeah,
that's right.
I think labs can really be enhanced. It's so hard for students to be an actor. It's so hard. You can tell them try to move like you would anticipate a patient move. They can't do it. And having them watch the videos ahead of time, come into class today, and if they're practicing any hands-on skills or facilitation techniques or whatever, at least they've got a view of that patient. And we've used other video tools where it was actual patients, but oftentimes they were really short. They didn't have this expanded look and multiple skills like I'm seeing here. This is really great.
Yeah, wonderful. Wonderful. And I think over time, we will probably, as we sift through the videos, we will probably release more content, but in reality, we really only have so much time in class. So I think bringing to the faculty just what they need to get the job done is sometimes better, because in the initial version of this app, it would probably have been 3 times the size with all the video, and no one would have time to find the video that would be useful. So we kind of sifted through it first to try to find videos that would do the job, less decisions to make for the faculty member. I'm curious whether you guys would think about after you teach the basic principles of activity analysis, task analysis, because I don't teach in this area, would you then do some of these analysis together in class followed by a couple of assigned. For example, you could literally go to the case, which I think what's nice about the case is a group of students or an individual student could read the history and then go about filling out the form for which, a selection of these key tasks. So doing it together so that they have some instantaneous feedback from US faculty, followed by assignment of case study Charmaine, everybody, you're going to turn in a worksheet where you have done the analysis on Charmaine. Any other thoughts about how you would integrate this into your own classroom and how you run this section of your class? Any thoughts or ideas?
This is Lori. So one of the things I'm thinking of is that, when we break down the task analysis, typically in my classroom is, I'm looking at it from a normal point of view, and then I relate it to, okay, so now with this patient who has this diagnosis, how are we gonna justify and problem solve out what transfer we want to do? How are we going to, justify what we're looking at as far as the body systems for specific disabilities? So this really gives them such a great visual to go back to and look at to be able to understand, and especially that you have like the typical and then the atypical.
Yes.
It's great for them to be able to say, oh, okay, so that person cannot weight bear on that leg, or that, that they're not able to have the coordination to do this. Is so important. And I think that's how I would use it as well, is just as, okay, let's look at this case study now. Let's decide, what we're going to do with them as far as what we would do in a functional way that we could teach them how to transfer so that they can, or how to stand so they can do this. So that's another way I would look at it. But I would definitely use it in so many ways, as assignments, as not assignments, as group discussion. It's just such a valuable tool because you can just keep going back to the video and back to the video. It's fabulous. Thank you.
And absolutely.
Yeah, I think it really helps because you've got different students at different capability levels, where you have a student that gets it super fast and you have other students that really need a little bit more time and repeated viewing, and it accommodates both spectrums. And so that ends up being really nice.
So how I've utilized this sort of activity is from when we were all on Zoom and going into breakout rooms. Now we're on campus, but I still sort of do the same thing. Let the students break into groups and assign this group to this patient, this group to that patient. Let them clinically reason, problem solve, come up with what you're going to do to treat this issue today, and then allow them to teach it to each other.
Perfect.
That's great.
Mm-hmm.
Yeah, because that's right. A great use of time really is each group does their analysis together, presents the video, talks about what they found, allows the faculty member to add their clinical thoughts, and then boom, it's on to the next group. And so you not only empower the students to take ownership of their analysis skills, but you also have effectively expose the students to a number of these different videos and different patients in a very short period of time. So I think that's a great way to use it in the group setting.
Correct. And then also just it enhances their ability to communicate.
Yes. To speak.
Because, they have to speak to the group and they have to validate their responses to the group. So, and take questions.
Yeah, fantastic. And in reality, I can think of doing this even if we were fully online. The groups just break out into 6 or 10 breakout rooms, 6 people each.
Exactly.
You guys have been each assigned this different patient, and then we'll come back out in 20 minutes. Each group will spend 5 minutes describing what they analyzed. It allows for infinite amounts of flexibility to still get the job done, I think, and that's what's really cool.
Yeah, sure.
Other thoughts? Great ideas. I guess maybe what I'd like to do is open it up for your thoughts in terms of what else do you need? What else would be useful that you can imagine that would be an adjunct to this? Any thoughts or ideas? Just 50,000 foot.
I have ICF written down.
Okay, yeah. And I also have mentioned how I think in the learn portion of this, it might be kind of cool, Mary. And this is actually from our last webinar as well, where people said, hey, it would be really cool. Yes, I love these answers are here because it makes it easy for me to talk with the students. I can always open the drop-down menu and use this as a jumping off point. But also to make sure that these are potentially hidden. So you have the flexibility of asking students to look at this, think about this, and then and just not having the answers just open. So I think that's something that we can do very shortly. Other thoughts? The other thing, Mary, I was thinking about is if you guys haven't seen yet, we have released a whole e-learning component. This is what we spent all year last year building. So on the NeuroSim component side, you will see that there are a lot of these different patients, and we have created, what I mean by a mini sim is it's a very finite task that I want the students to go through, and the learning objective is very, very small and very defined. So in this game with John, I just want students to go through the process of identifying the appropriate test for fall risk assessment, doing the test, and scoring the test. So all of these little games are now, hey, this is John, Asia D spinal cord injury. He's having difficulty with balance and ambulation. What test would you like to do to assess his fall risk? So what is the appropriate setup? So I'm just gonna go, let's see, 6 minutes. Let me just try that. No, it's 3
Could be
meters.
incorrect.
Sorry.
Yeah, 3 meter.
Sorry. And then as you go on, it's seated with the back against the chair. How should he begin? When should the time start? Time is started when the patient's back leaves the chair. Stopped. Okay, let's go there. And then here it begins. So the students will now start the timer at the appropriate time. So let me reset the timer.
The blue piece of tape, you're going to turn around that tape, come back to the chair and take a seat. Okay. All right. So ready, set, go.
Start the timer. When he returns, you stop the timer. And then we ask you what was the appropriate time. And then we ask you to interpret. What is the recommendation you would give him? And here is a hint. So as the students go through, he should use assistance, submit. There's a little bit of movement analysis here, but I guess what I want you to see is when they are done, they have a learning history. This learning history can be downloaded and turned in. So we tell the students, hey, you can play this game as many times as you like. I will take the highest score. Here's who did it, when they did it, which game they played, how much time they spent on it. And this is how we're asking the students to interact with this content. So the reason why I bring that up is because, Mary, I'm thinking about perhaps creating mini games, and we can build it off of some type of task analysis.
Sure. Yeah.
So that could be, and then we could build that as the homework. It's an interactive, it's scored, the students can fill it in. I don't know exactly what that looks like yet, but it's something that we can build over.
Yeah, we can talk about it. Yeah. Yeah. I think that would be a great idea. Then it could be something that's graded automatically, and it takes one less thing off of the professor's plates.
That's right. That's right. That's the reason why we're building all of these different mini games, is because one, I think when the basic knowledge has been delivered and now you've interacted with them in the classroom and helped develop that practice pattern, it's very important then to give students low stakes simulated, right? So patient-based scenarios to play through to now unpack and apply this content. So, I mean, we're busy building wound care games. I mean, if you look at all the different elements that are here, it covers acute care, neuro, physical agents, orthopedic rehab, range of motion MMT. This is just, we just released this week. All these different types of debridement types, dressing, lymphedema, wound types. These are all low stakes games that I think help students engage with the material and unpack everything that's just kind of jammed in there, and they haven't really had a chance to really play with it.
Mike, I got to step off the call. So
Yes.
there's some very good comments on the chat if you want to sneak a peek at it. And maybe Mary, you can take over monitoring the chat if there's any immediate question that people have.
Oh,
But
awesome. Okay.
I'm gonna step off.
Yeah, thanks, James. Yeah, Gary, thank you for that. We'll make a point to build some of these. I think it would be kind of fun for the students to do, and it makes it easy. So literally you could just say, hey, this game, guys, it is in your syllabus. Copy page title with link. Please play this game and turn it into the Google Drive or into the LMS. You're going to get points for playing these games and turning in these assignments. So I think you can see the philosophy there. Didactic delivery of content, interaction with the students in the classroom, and then low stakes ways to interact with the content and really apply some clinical reasoning. So other thoughts, comments?
So mini games would be appreciated.
Yep.
And it looks like a few people have needed to sign off.
Yes, yeah. So I know we've gone a little bit over time, but I just wanted to let you know that we have a neuroanatomy app that's in the works. It's really cool. It has interactive mini games that build the knowledge base. Then there is models. There are 3D models of tracks, as well as anatomy by slice, neuroanatomy by slices, and identifying pins. It's really cool. It'll probably take us another 6 months to finish it. We've already spent a year working on it. We use real images, real slices of the brain. So that's coming as well. So I just want to let the neuro group here know that the neuro package is going to be amazing, amazing when we're all done. A lot of it's already really cool. Okay, so the last thing I was just going to say is hope to see you guys at CSM. Next, let's see, February 11, we'll be talking about the range of motion MMT and palpation app, the range of motion MMT Sims, as well as the surface anatomy palpation app. Thank you guys so much for your insight, your thoughts. You should, if you don't already have PhysioU access, and I think for Lori, we have OTU access for you too. I'd love to touch base with you.